Assalamu alaikum to everyone present here. The chief guest of this function, Dr. Jaishankar sir, the organizers of this function representing Anaikar Rafeeq Hospital, Dr. Nikat Anjum, our medical superintendent, my father, Mr. Ayaz Akber, my mother, Mrs. Saira Parveen, and other dignitaries on and off the dais, the press, and our esteemed audience. I'm extremely grateful to the organizers for giving me this opportunity to address this August gathering here today. Healthcare, as we know, is an extremely important asset, and in this ancient city of Ambur, Anaikar Rafeeq Ahmed Hospital has been rendering excellent services and always improvising for the benefit and well-being of their patients. Our bodies are our amana from Allah. It has been given on lease for a period of time to utilize and make best of whatever we choose to do. The age-old saying that when health is lost, something is lost definitely holds true. Unfortunately for us, it took a major viral pandemic outbreak to rekindle our curiosity towards how our bodies work. But most doctors and healthcare workers have always believed in prevention of disease before it has occurred. And we as a population need to first work on the basics of disease prevention. I'm going to be a bit more specific in my talk today and explain to you about prevention with regards to heart disease, or how can we prevent heart disease. Prevention itself can be of three types. Primary prevention, that is prevention of heart attacks in those with diabetes, hypertension, high cholesterol. This is still very useful and is not very expensive. We can do it by establishing a good OPD practice, outpatient department practice. Secondary prevention, that is prevention of major heart attacks in those who already have blocks in their arteries. This involves angioplasty, that is what Sir has been teaching me recently, and he is an expert in the field, and even bypass operations, which we know are very expensive and involves extensive hospital admissions. Even this can be done with the help of a lot of government aided agencies such as the Chief Minister's Scheme and the ESI, Employee State Insurance Act, which is providing free secondary prevention. And tertiary prevention, that is after heart attacks, once the heart starts to fail, we need to constantly monitor patients. They sometimes require devices to help their hearts pump better, medications which are very expensive, and sometimes the only resort is to have a heart transplant. First and foremost, we must understand what are the different types of heart disease. First and most common is coronary artery disease, which is commonly known as heart attack or myocardial infarction in medical terms, but commonly it's called as heart attack. The other diseases include valvular heart disease. In medical terms, it's rheumatic heart disease. Cardiac muscle disease is called cardiomyopathies. They're usually genetic or inherited or because of uncontrolled diabetes and alcohol intake. Cardiac electrical diseases such as abnormal heart rhythms, where the heart's pacemaker system and conduction system, the electrical system, is flawed. Congenital heart disease, which occur in children, which are basically hole in the heart, which is commonly known. Infective and inflammatory heart disease, that is because of COVID, we are seeing a lot of inflammatory heart disease or infective heart disease. Tuberculosis, which is still prevalent in India, and viral heart diseases, etc. Of these, again, I'd like to reinstate that coronary artery disease, that is heart attack, is most common. and this is what we need to know how to prevent. So what is the mechanism behind heart attacks, you may ask or you may question? Basically, it is due to the accumulation of excess fat circulating in our blood. This fat, along with calcium and other harmful toxic substances called free radicals, go and start accumulating within the walls of blood vessels when they start accumulating within the vessels supplying the heart itself. And once it starts accumulating within the vessels supplying the heart itself, then it can lead to symptoms such as breathlessness, chest pain, and most commonly it can end up with complete occlusions causing heart attacks. So basically, what you and me might have eaten 1.5 hours, maybe a big plate of biryani and a Coke, and if we have the unfortunate habit of smoking, could have contributed maybe a minuscule amount to what we already have. जो था maybe एक 50% था, अब 51% होगा. उसके बाद जाते जाते हमें आको खैर करना को खाते जाते आता आता दर्द. Then we are in trouble. So before that happens, there are certain risk factors. If we address early enough, we can definitely prevent clogging up of our arteries. So what are these risk factors? There are 6 modifiable risk factors, such as stop smoking, control diabetes, control hypertension, prevent obesity, regular exercise, and stress reduction. मैं उर्दू में बोलता हूँ, स्मोकिंग स्टॉप करना, शुगर है तो शुगर कंट्रोल करना, बीपी है तो बीपी का दवा रेगुलर से खाना, मोटे है तो रेगुलर से एक्सरसाइज करको वेट लॉस का संभव हमें आपको अचीव करना, उसका मेहनत करना वेट लॉस करने के वास्ते, रेगुलर से एक्सरसाइज करना, दुबले है तो भी हेल्थी वैसा क्या भी रिलेशन नहीं है, मे बी जरा बेहतर होगा बट एक्सरसाइज जरूरी है सबको. एटलीस्ट हफ्ते में 5 दिन एक्सरसाइज करना और एटलीस्ट 30 मिनट्स रेगुलर एक्सरसाइज करना. सो 150 मिनट्स एक हफ्ते में रेगुलर से एक्सरसाइज करें तो इट्स अ प्रिवेंटिव मैकेनिज्म. स्ट्रेस रिडक्शन वो हमारे हाथ में नहीं है बोलते, बट दैट्स नॉट ट्रू. इफ वी डू adhere to 5 times namaz, I think quite a lot of stress can be reduced. So we should try and adhere to that, inshallah. And what are the non-modifiable risk factors? Something which is not in our control. हमारे काबू में कंट्रोल में नहीं सो चीज़ें आपको, हमारे फैमिली में हार्ट डिजीज होना, मेल जेंडर हमें मेल होने के मुताबिक we have a higher risk of having heart disease, and females after menopause उसमें भी इक्विवेलेंट हो जाता. जब मेनोपॉज आ जाता हम ना इक्विवेलेंट हो जाता. सेम रिस्क अमाउंट फॉर दोज हु आर पोस्ट मेनोपॉजल फीमेल्स एंड मेल्स and age more than 40 years. So these are the non-modifiable risk factors. So by addressing the modifiable factors and taking precautions, and especially if you have non-modifiable risk factors, you can clearly reduce your chances of having a sudden heart attack. Basically, हम ना आपको ये modifiable हमारे genetic trait में हमारे फैमिली में कोई ना कोई किसी को भी हार्ट अटैक का हिस्ट्री रह सकता, सडन डेथ का हिस्ट्री रह सकता. और डायबिटीज और इंडिया में इट्स गोइंग टू बिकम द डायबिटिक कैपिटल ऑफ द वर्ल्ड. सब जगह 1 in 3 persons हैव डायबिटीज और हाइपरटेंशन. सो चेक करना जरूरी, स्पेशली इफ यू हैव फैमिली हिस्ट्री ऑफ हार्ट डिजीज, मेल जेंडर, फीमेल्स पास मेनोपॉज and age more than 40 years. It's definitely good to go and get a BP check and also a sugar to be assessed. If you have non-modifiable risk factors, the precautions you must take are by having mandatory checks with a physician and cardiologist if possible, more so if you are more than 40 years of age. To sum it up, the best system of healthcare is primordial prevention. मैं एक चीज बोलिया नहीं, primordial prevention. That is basically prevention of occurrence of risk factors. This can only be done with good, healthy eating habits right from an early age, adequate exercise and sports, etc. If our generation has missed out on this current piece of advice, the future generation must be encouraged towards this right from the beginning. हमें आपको भूल को हमें आपको स्टार्टिंग से हमें अडियर नहीं करे. ओबेसिटी आगा, स्मोकिंग कर देने, डायबिटीज, शुगर, बीपी अनकंट्रोल होगा, हमें रेगुलर से एक्सरसाइज नहीं करते, हमारा स्ट्रेस बहुत ज्यादा है. ये पूरा आने के पहले हमें आपको हमारे बच्चों को ये एडवाइस देखो. young age से हमें उनको वैसा guidance दिए तो maybe we can prevent them from even coming to this discussion of heart disease. That is called primordial prevention. Prevention of occurrence of even risk factors. I'd like to end my talk with a famous saying by Desiderius Erasmus, a Dutch philosopher from 1500. Basically, prevention is better than cure. Thank you.